So welcome everyone to the first webinar training for the Healthcare Workers Care Network, focusing on the mental health of our healthcare workers on the front line during COVID. Tonight series, it's the first series, and we're really going to be unpacking as much as we can and sharing really helpful tools and tips that you can use practically in the workplace. What we have tonight is a lineup of some really great speakers, and I'm really proud, especially since it's Women's Month, that our lineup of speakers are all very powerful, strong women who are here to share as much information about their passion so that we can make sure we look after our healthcare workers during COVID. This evening we have psychiatrist Dr. Antoinette Murch, as well as Prof. Tanya Haynes, all the way from the University of Pretoria. We also have Prof. Rita Tom and psychologist Judith Anser, who will be going through the segment tonight. I'm going to now just hand over to our first speaker, Dr. Antoinette Murch, who will be showing her slides and presenting. Again, if anyone has any questions, please put it in the chat box. We really appreciate it. Just for a quick brief of Dr. Antoinette Murch, she is a psychiatrist with a private practice in Saxonwold, Johannesburg, and she has a keen interest in the mental health of our healthcare workers. And she is going to kick off our evening tonight. Welcome, Antoinette.
Thanks, Cassie. You've got the master control over everybody. So I was muted. I see that some people are having some sound issues, and it's not everybody. So it must be the people who are having sound issues, their own audio. So my suggestion is that you check all your settings, you log in and log out if you're having major issues. But the majority of people are hearing, so I suspect it's the individual issue. Just a note about CPD points just before I start. I'm really excited the CPD points came through today. So there will be CPD points for each webinar, and I will explain at the end how to get them. We're going to have asked the people who do qualify for CPD points to send us their details, but I will be sending you a link after the webinar. So with that, I'm going to start my presentation. So welcome everybody. Welcome from wherever you are. The turnout is amazing. We had over 600 people. Sorry, just hold on. Sorry, apologies. There's just some gremlins I'm trying to share, and it's sharing the wrong thing. Cassie?
Hi, Antoinette. Sorry, we're still seeing your presenter notes.
Okay, I'm just trying to figure this out.
Perfect, that's better.
Okay, sorry about that. You would have thought by now I would know how to do it. So as I was saying, yeah, there are CPD points, and I'll give you some more information. So my name is Dr. Antoinette Murch. I'm a psychiatrist, and myself and quite a few colleagues are formed the Gauteng part of the Healthcare Workers Care Network, which has since gone national. We're really excited. Today is a special day. The University of Pretoria has signed a memorandum of understanding with us. So they are official collaborators. I think the main point I want, which I hope comes through quite strongly, is that healthcare workers at the moment are going through a lot of anxiety, distress, and mood disturbances. However, this is a normal reaction to an abnormal situation, which we all found ourselves in. And as such, we need to be very careful not to pathologize it. And it's about holding the dialect. So it's holding the fact that this is a normal response to the situation. And the normal response does not mean pleasant response. It can be quite a distressing response. So holding that in mind while also identifying and recognizing that some healthcare workers who are more vulnerable for many reasons, which I'm going to go through, are more prone to mental health, significant mental health conditions. And I'm going to take you through a little bit of that research, and then we're going to chat to Prof. Tanya Haynes from UP, then we're going to move over to Prof. Rita Tom, and end off with Judith Answer. We will be doing questions at the end. Please put your questions in the box. So how is this pandemic traumatic for healthcare workers? When we think of trauma, we often associate it with something overtly violent, such as a car accident or a shooting or a hijacking. And the situation is traumatic when it violates familiar expectations about someone's life and world, sending them into a state of extreme confusion and uncertainty. Now, as you can appreciate, in the case of this pandemic, prolonged uncertainty, and this has been really long. So we've, because we were behind the curve, we had a long period of anticipatory anxiety, and we're still in the uncertainty phase. The prolonged uncertainty is compounded by the moral anguish that healthcare professionals face when they do not have adequate resources to treat critically ill patients. And this is this is due to the way our health structures are, but it also is due to the nature of the pandemic. The preparation worldwide was not optimal, and I'm not sure if it ever would be optimal. But it does result in quite a lot of moral anguish with healthcare professionals. This is quite just a useful concept to just keep in mind. I was at a virtual bipolar conference a few weeks ago, and Dr. Roger McIntyre, who's a psychiatrist in Toronto, described what he called the triple threat to mental health. And if you look at each of these circles, the financial stresses, the threat to health, the social isolation and loneliness, each one of these conditions or circles is enough to cause a mental health condition, should it be severe enough and long enough. However, with this pandemic, we are facing the combination of all three of these. Now, this diagram applies to the general public, but also to healthcare workers. When you look at social isolation and loneliness in healthcare workers, I think what's important to know is that the social isolation is with the healthcare workers from their family and friends, but also from their colleagues within the working environments. They're all hidden behind PPEs. You're not getting those natural body language signals. And they're also disconnected from their patients in terms of they have to be, in terms of their safety, and also if there are periods of large burden of patients, they are missing out on that. I read somewhere there was an article about one of the hospitals in South Africa, and one of the comments was, where are all the families? And obviously the families aren't allowed in, but it's so strange to imagine a Baragwanath without that hustle and bustle of visiting hours. The hospitals must feel absolutely dead, and it's that feeling of isolation combined with the uncertainty. And then the financial stresses. So specifically in the private sector, healthcare providers have been facing major economic challenges. Some people have had to retrench staff, close down practices, And then also healthcare workers are married to other people in the community, and we know that there's been a lot of job losses. So there is significant loss of income, which will result in a stressor. I wanted to take you, so Roger McIntyre was from Toronto, and Toronto is unique in that they had a SARS outbreak. So Toronto and Canada were one of the places, and then China and Singapore were the other places. So if we look at the SARS outbreak, it was in 2002, 2003. I didn't realize, but there were only about 8,000 cases of SARS. And if you think about, I looked at the numbers just now, 18.5 million cases of COVID worldwide, and we're approaching 700,000 deaths. So you can't really compare the two pandemics. However, this was a research study which looked at the impact of SARS on Beijing hospital healthcare workers. They looked at over about 500 healthcare workers within a tertiary setting. And what they found is 10% in the 3 years afterwards had post-traumatic stress symptoms. So that's any time in the 3 years afterwards. But most significantly, 5% still had symptoms at 3 years, which were related to the stress of the SARS epidemic. The 5% is in keeping with what we know for post-traumatic stress numbers, but it is quite significant. And these things I'll bring to your attention again and again. The major stresses are healthcare workers who were quarantined, healthcare workers who were close contact with a SARS infected patient, and if they had a close family member or friend affected. Just a note that all of these sites will be available, and we have actually made a little manual with all the references, and that will be all sent to you via a link. So back to SARS in 2002, 2003. Now, we look at the study from Toronto, and there were actually, when I looked at it, there was only about 250 cases in Toronto in their main hospital. The case fatality rate for SARS was higher. It was about 17%, so it was significantly more deadly, and it was significantly more contagious. However, the numbers were much less. But this was a research study looking at over 1,500 healthcare workers, and these were post-traumatic stress scores, which was scored on what they call an IES score. What is quite useful about this is we can see quite clearly what the risk factors are. So what they found is that healthcare workers with an increasing amount of risk factors were more predisposed to have significant post-traumatic stress symptoms 2 to 3 months after the SARS. And the risk factors which increased, and these risk factors make complete sense, but I want to re-emphasize them because it really can help kind of management, is exposure to the virus, healthcare workers who are parents as well, nurses, society rejection, behavioral avoidance, and attachment insecurity. So when we're talking about society rejection here, Toronto, and specifically in Canada, they had major issues in terms of the subways. The medical people were ostracized. And actually, because of the contagiousness of the virus, a lot of the healthcare workers would start avoiding others. And, we need to watch out for that. So now going back to the current pandemic, the research is coming through, and I'm going to take you through 2 bits of research, one from China and one from New York. The prevalence, this was a cross-sectional hospital-based survey of over 1,200 people, hospital-based nurses and doctors. It was done in the last week of January in Wuhan, and if anyone knows, the stats, that was kind of 3 to 4 weeks into their pandemic. Nurses were the majority people who answered the surveys. The majority of people were between the ages of 26 and 40, and majority were female. I think what's quite significant here is you can see the high level of distress. It was recorded on a similar scale to that one you saw before. About 70% of those people were reporting distress. 50% depression, anxiety, about 45%, and about 30% insomnia. What's quite interesting with these stats, and then also with the New York stats, is the amount of distress, from what I can see in some of these studies, anxiety, depression, and insomnia in healthcare workers compared to the general public is actually the same. So the rates of distress are actually very similar, as you can imagine, to the general public. However, healthcare workers do have kind of quite a unique role. This was another nice study, which is actually going to be going on. This was a preprint. The COVID-19 healthcare provider study in New York. It was looking at a wide range of healthcare workers, all working in a tertiary center. Looked at about 600 people. You can see the response rate is quite low. I think that's because they're really busy. In mid-April, the number of COVID cases were about 230,000 with over 13,000 deaths. This is a slide which I've taken from the article. And what this shows you is they looked at 3 measures. Which is quite useful, they looked at an acute stress disorder measure. Now, for those of you who are in mental health, you know that acute stress disorder is within a month of the trauma, or a month of the, in this case, the pandemic starting. So it's quite a good study that they were able to get it done so quickly and were able to use those acute stress measures. And then they looked at the PHQ-2 and the GAD-2, looking at depression and anxiety scores. So what's quite significant is 64% of nurses reported high acute stress disorders scores, which means that they fitted criteria for acute stress disorder. And then what you'll see as I go through is that the residents, which will be the more junior doctors, are the next, and then the more senior doctors are less than that. So that rate of acute distress of 64 fits in with that Wuhan study of 70% level of distress. I'm going to just end off here talking about the common factors across all the studies, and you'll see some of these references. They're coming from Spanish studies, from Italian studies, and I've taken in the information from the New York. So specifically, females are more likely to experience mental health difficulties. Nurses are more affected than doctors. Younger, less experienced healthcare workers are more effective, and not surprisingly, healthcare workers on the front line struggle more. But they struggle more significantly. So in research, it's a significant difference. What makes complete sense, but is not always top of mind, is healthcare workers experience more significant signs of distress, i.e. leading to mental health issues, when a colleague is unwell or hospitalized, when a colleague passes away, the colleague is in quarantine. And I've been hearing quite a lot of stories of colleagues passing away in ICUs, specifically all over Joburg. And those healthcare workers around that, who've worked with that colleague, they are specifically at risk of a later mental health issue. Healthcare workers are more prone to depression if they're directly exposed to the virus, and I think that makes most of the frontline healthcare workers or are infected with the virus. So this is another group. So if a healthcare worker is infected and then they've got a colleague who's sick, these are healthcare workers which we consider higher risk. So why should we worry about the mental health care work of South African healthcare workers? I don't think I need to tell anyone on this webinar, but we have a limited number of healthcare workers. We need an emotionally strong working healthcare force, and healthcare workers were already struggling before this pandemic. This is just a slide which looks at, prior to this pandemic, healthcare workers were struggling. The most researched study topic in South Africa is burnout. A lot of the studies are looking at emergency medicine, anaesthetists, critical care nurses, and prior to the pandemic, there was very high rates of burnout. So if we looked, this 2019 study looked at 170 registrars in clinical medicine, 84% rate burnout. I think what's important at these registrars are now, they're probably still within the system, and they were already burnt out before this started. So without a healthcare army, we cannot win the war And psychological preparation and crisis intervention is pivotal in preventing these mental health difficulties. Good physical and mental health are important to manage this intense and persistent workload. We're in a marathon relay, and it's useful to be aware of which psychological factors have been shown to improve or worsen mental health outcomes. So the individual factors, personal factors, and service factors, and there's a reference for all of these factors. It's actually a really good article from Kisley from the BMJ from this year. So factors that increase the risk of adverse psychological outcomes. So if you're wanting to do any interventions or look at vulnerable staff, these are important. Some of them I've already discussed. Individual workplace factors include contact with positive patients. Forced redeployment, I think, is really important. So if you're putting a person who is not used to working in ICU into ICU, they have a higher rate of mental health difficulties, once again highest in nurses, and that's why I'm glad Prof. Tanya Haynes is with us, who's a prof from UP in nursing sciences. Less experience, lower education, part-time workers. The workplace factors, and we're going to talk quite a lot about this in our second webinar, where we're going to look at employers and leaders and managers. What's quite interesting here is it's a perceived lack of employer support, a perceived lack of adequacy of training, lack of confidence in infection control, no compensation for staff by organizations. So there are a few studies which have shown that compensating staff during a pandemic protects against negative psychological outcomes. And then societal stigma against hospital workers. I don't think we're seeing that too much in South Africa at this stage. I'm not sure. Factors that increase, other factors that increase, these are your personal factors, and these are particularly these are the vulnerable people, healthcare workers we need to watch for. They're the younger single females with children at home who have an infected family member potentially with a lower household income, have pre-existing comorbid health conditions or mental health conditions, lower perceived personal self-efficacy. So this is an underlying personality characteristic or structure that they feel like they cannot cope. History of any psychological distress or mental health disorders, specifically also substance use disorders. So if we are looking at which healthcare workers are at risk, this is a specific group. And I think if these people cross your paths, I think it's really important to be aware of the outcomes. So that is just what I wanted to explain to you is what some of the research is showing, and also which specific healthcare workers are vulnerable. We can't just blanketly say that all healthcare workers are vulnerable. Yes, we're all under stress, but we can target our interventions quite nicely. Thanks, Cassie. I'm going to hand back to you.
Thanks so much, Antoine, and thanks for that intro. You know, I've again had the pleasure of hearing a lot of those stats, but literally seeing how it's changing every day and it's growing. And I think it's so important that as South Africans, we can actually track what is happening overseas and how we can use that here in South Africa. So now I'm going to introduce our next speaker, and I get to do almost a Q&A with Prof. Tanya. And I'm going to ask her just to say hi. I just really wanted to ask her a couple of questions in the next 10 minutes to really understand from a nurse's perspective. So if we have to look, Prof. Tanya, just let me know if you have any problems.
No, I'm fine, thank you.
Fantastic. So if we just introducing Prof. Tanya Haynes from the University of Pretoria, we're very excited as the Healthcare Workers Care Network to partner with UP as an academic institution. He's also the Associate Professor from the Department of Nursing Science and an executive member of the Critical Care Society of Southern Africa and the Emergency Nurses Society of South Africa. And I just really wanted to get an experience because I know that you talk a lot to nurses on all kinds of different platforms across the country to really find out from your experience from speaking directly to the nurses, what are some of the issues that the nurses are dealing with or facing during COVID-19?
Thank you, Cassie, for the opportunity. I think what Antoinette has said really summarizes what the nurses are saying. The first thing is, I think they have to acknowledge, well, the first thing they're saying is they're working in a chaotic environment. Their knowledge, skills changes every day. Every day there's new, better practice guidelines. So the way they nurse are totally different. Where they used to be able to hold a patient's hand when he's scared of dying, they can't do that now. When they used to be able to phone a family and say, listen, come and sit here, come and sit with your loved one, they can't do that. So their whole environment have changed. PPE has made a huge difference. I mean, we all know getting it on, off, going from tent to tent. I mean, in one public hospital, they've got 4 tents. 8 people work there. So say, for instance, you have to prone a patient in one of the tents. You need 6 of the 8 to go to that tent. 6 of them have to dress, go to the tent, undress, go back to the other tents. So it's a huge impact on those nurses. They work 12-hour shifts. They hardly eat or drink in those shifts. So they're physically exhausted. And I mean, just like all over the world, they've got the pressure sores over their noses, over their foreheads, it's discoloration. They really are. But the mental effect thereof is even worse. Just like, I mean, I want to support what Antoinette just said. I mean, at first, when they were preparing, all agency staff overtime was stopped. And nurses, we know, are often the breadwinners of households. So all their overtime was stopped, no more overtime. They lost a lot of money to support their families. So that is where the stress started. Then now we're continuing in this stressful situation. They've got a fear that they will get the disease. They see people who are fine walking around, go to the bathroom, coming back, dying. They didn't think they were sick, and now I'm going to get it. I'm going to pass it on to my family. My mom and dad stays with me. They've got comorbidities. All that affects them. They say to me they mentally exhausted. And then if you listen from management sides, I mean, it would be very interesting to study this further. Management see it as a very positive. We are upscaling the skills of nurses. We're getting them from the wards. We're putting them in critical care. They're having this opportunity to look after critical ill patients, etc. But if I look at what Antoinette now says, it could be a disaster for our profession because they can't actually cope. And we also see that the leaders struggle to sort of keep an eye over all these people, making sure that patients don't die. I mean, just if you look at the tents, etc., the nurses are so, I mean, there's cylinders standing in the tents. Cylinders drive oxygen. The people need oxygen. Now you're having patients arrested, patients waiting queues. This is in the public sector mainly. I haven't found that in the private sector. The other thing that was, so from a management side, they see the upscale of skills as a huge positive. The other thing that was very interesting to me, Antoinette is saying that the young females are at risk. But when I spoke to such a lot of them, what they say is, and this is what the people in the ward say, and I don't think they recognize what's going on in their mental health. I don't think they are aware. But they say the young ones are the ones who's coping better. The young generation, they come to work, they do what they can. If they don't do something, they don't do it, and they don't give a damn. This is what they say. But the older generation are more sort of, I have to do it, I have to get to everybody, I have to make sure I've done it. They're the ones who phone back at night saying, listen, I forgot to do this, just do this quickly. So in practice, it's totally the opposite. They feel that the young ones are coping much better, and it's the older generation that's actually struggling more. So that for me is very interesting, and it would be great to have a look at that. So PPE is a big concern. Some say they've got enough PPE, but the big concern really is, yes, you get PPE when you look after COVID positive patients, but People who's not positive, you don't get PPE. And to give you a good example, one of the professional nurses, she works 3 months in a COVID positive ward, never gets COVID. She goes into a ward 2 weeks later, COVID positive, because she had no PPE. And yet the patients lying there are awaiting their results, not having their results, so they could be positive. So for me, that is unfair and unethical practice, and this happens all over. I don't know if there's anything else, but I think mentally and physically, they can't do it anymore. And you can hear the distress. They're anxious, they're biting at each other. But on the other side, they know if they don't work in a team and they don't work together, they're not going to survive this. So there's a lot of let's work together and shutting off the negatives. So if there's negative people, they just let them go because they know they can't cope with that as well. We're going to focus, go forward and try to do the best we can with the people we have, support each other, specifically when they're sick.
Absolutely. And I think you've even touched on it briefly, the difference that you've seen in the public or private sector for nurses. Maybe you can just touch on that for us.
Yes, I think PPE is a concern in both. I think staff shortages, a concern in both. What makes public different is the number of patients. Huge difference. Number of patients versus staff. Many more patients, many more ventilated patients. I mean, you get one professional nurse looking after 6 patients, etc. But the private, we mustn't underestimate. The unit managers call themselves now the bed hunters. So they can be looking for patients for a bed and phone up to 25 hospitals to get a patient a bed. So that is just as frustrating. So I always think of, we did a study in public and private, and we found it's not about what the place looks like, it's about the people working there. And we must remember, the agency staff work in private and public, so it's the same person. The doctors work in private, so the people makes a place a difference. It's not the building. So
Absolutely.
we have found there's no difference in the end. If you really go and look, there's a difference in the building, but the rest stays the same.
Exactly. And it's those people that we want to invest in. And I think just a last question is, what are you finding that can actually help nurses cope during this time? What perhaps strategies are working in the field, things that you possibly have seen that are working? What do we do to make sure we look after the mental health of our nurses on the front line?
Yeah, I think spirituality, we underestimate that. It's as if spirituality flares up everywhere now, and it's even more so. So then singing in the morning, that is getting more and more. And then obviously getting appreciative feedback. So in private, you can see that they do get feedback. They get little letters from school children, they get songs by the community, praising them for their work. But this is not the same in public. And for me, that is sad. They're not getting that same appreciation. So I think the first thing is we must start appreciating what they do, because they're really trying hard in very, very difficult circumstances. And then we must get them to realize how important it is to give attention to their mental health. If we can do that and get them to give a little bit of attention, take time for yourself. They're carers. They care for everybody but themselves. And if we can turn that around, maybe we can make a difference.
Thank you so much, Prof. Tanya, and thanks for your passion and just bringing, nurses out of the darkness and into the light as part of this fight for COVID. And we really are thrilled to have you part of the team so that we can make sure we look after the mental health of our nurses going forward. And we look forward to that collaboration. And we're going to see lots more information and resources for nurses coming up on the Healthcare Workers website in the next few weeks. So if anyone has any specific queries with regards to nurses and support and mental health, we will make sure that Prof. Tanya's details are available throughout the session. So thank you very, very much.
Thank you very much, and thank you. Looking forward to our collaboration.
Fantastic. Thank you. Now I get to move over to our next speaker, Prof. Rita Tom, who I've had the pleasure of working with for many, many years on various projects. And if we look now, she's just going to be talking to us a little bit more about the stress resilience and how to recognize and regulate your stress levels during this time, which is probably important for us as individuals, but also for the people that we work with on the front lines. So Prof. Rita, welcome. Over to you.
Thanks, Cassie. I'm just going to share my screen. Okay, so thanks to everyone for joining us in this webinar, and I'm going to be talking about this topic of stress and stress resilience, and this is largely based on work by Dr. Bruce Perry, who's an American psychiatrist who's done a lot of work on trauma and adversity, and I'll discuss some of the neurobiological basis of regulatory systems that we have to manage stress and build resilience, as well as some fairly simple measures that can help us all, and particularly in this case, healthcare workers, to improve their response to stress. So to start with, it's important to understand that stress is actually an unavoidable part of life and is in fact necessary in order to build resilience. And resilience can be defined as the ability to recover quickly from difficulties. And it implies a certain toughness as well as flexibility. And it's a quality that helps individuals and communities to thrive and grow despite difficulties. In the current pandemic, we're all facing a period of unprecedented stress with much uncertainty about how it will all end. And therefore, we need to monitor our stress levels and patterns of stress wisely. So a key message of this session is not to be afraid of stress, but to note that stress places a demand on the body's equilibrium systems, and that we actually have a host of stress response capabilities which keep us in equilibrium. So we need to keep an eye on our stress levels, but also on the pattern of stress. So just to look at some of the physiology. In our brains, we have top-down and bottom-up regulatory mechanisms, which can help to manage stress and maintain equilibrium, or if they're overwhelmed, can result in dysregulation and an inability to cope and feeling overwhelmed. So this slide describes mainly the top-down regulatory networks. Note that there also are bottom-up regulatory networks, which I'll talk about how we can use them a little bit later. But just briefly, if we look at this very simplified sketch, the brainstem is responsible for quite a lot of the physiological regulation of things like blood pressure, heart rate, body temperature. The midbrain is responsible for quite a lot of regulatory activities, such as the sleep-wake cycle, appetite, arousal, motor regulation. And then the area that psychiatrists and psychologists are most interested in is the limbic system, which is the seat of our emotions, what we sometimes call the emotional brain, and then the cortex, which is what we refer to as the thinking brain. So these systems work within each other and help to regulate each other. So if we look at stress, we've mentioned that it can be a positive thing or it can be a negative thing. And we note that if stress is predictable, moderate, controlled, then it helps us to be able to manage stress in a way that increases resilience. Whereas if it's unpredictable, severe, uncontrolled stress, that makes us more vulnerable to distress. So you may say that in the current scenario, healthcare workers have little control over the pattern of stress that they're exposed to. And it's true that much depends on the environment in which one works, as well as other stresses outside of work. Judith will speak in the next section on what managers and leaders can do to support frontline healthcare workers, and that's been found to play a significant role in preventing burnout and other mental disorders. But it is possible for us as individuals, with simple measures, to shift the pattern of stress to develop more resilience to stress, or on the other hand, with certain behaviors, to increase vulnerability to distress. So back to this diagram. And as I said, interventions can be made at all 4 levels. So at the brainstem level, simple physiological interventions that engage the autonomic nervous system can be very helpful. So I'll talk about that a little bit later. Instituting daily routines, making sure one gets enough sleep, one gets enough exercise, one eats properly. These are all routines that help one to regulate. And in terms of emotions, social connections with other people are very important in terms of helping to regulate one's emotions. And then being able to think about what is happening and to be able to process what is happening is obviously very important in terms of maybe putting the brakes on emotional reactions or helping to regulate some of the physiological activities. But as I said, it can work both ways. So it can work top down or it can work bottom up. And I think in the kinds of scenarios that we're in at the moment, often it's quite difficult to engage one's thinking brain because one's in a state of survival and when it's in a state of crisis. So sometimes being able to work bottom up can be more helpful. So if we talk about the autonomic nervous system, we know that there are 2 parts to it. There's the sympathetic nervous system and the parasympathetic nervous system. And our sympathetic nervous system is what is engaged when we're in a crisis and when we're needing to survive. And this is our fight or flight system. And this creates a state of arousal. So when this system is on the go all the time, we may end up in a state of hyperarousal. The parasympathetic nervous system, on the other hand, is the system that helps us to calm down and to maintain homeostasis. And we need to maybe, in this kind of scenario where we're in a state of constant hyperarousal, to quite consciously engage the parasympathetic nervous system. And one of the simplest ways to do this is through breathing techniques. Now, breathing techniques can activate one or other of these systems, but we more commonly try to engage the parasympathetic nervous system. And just recently, our group of volunteers had a wonderful workshop with Dr. Ella Munger, who's a South African doctor who founded an organization called Breathwork. And there are numerous techniques that one can use for different reasons and in different scenarios. And I'd really encourage you to look at her website for some ideas around this. So looking a little bit more broadly at tools to manage stress, Dr. Perry talks about recharges, so they're macro recharges and micro recharges. And macro recharges may be something like taking a holiday, so having a long period off work and out of the stressful situation, but that's maybe not entirely possible at this stage. So maybe what we need to focus on a little bit more are the micro recharges. And these are protective measures that can help prevent dysregulation and burnout. And it has been shown that even very short interventions can be helpful. And these micro moments can be as short as 90 seconds. But if they occur at regular intervals, they can help to reduce stress. So these strategies need to be intentional and, if possible, built into one's daily routine. So instituting some rhythm in one's day at work and at home can help to counter some of the unpredictable parts of the day. So here are some suggested brief ways of recharging. Some of these one can incorporate into one's daily work life or one's daily home life. What I want to point out here is the issue of social connectedness, which we've spoken about before in this webinar, and it's highlighted as a key regulatory mechanism. Dr. Perry describes something called relational contagion. So if you are connecting with people that can help you to feel better and to down-regulate or self-regulate, that's helpful. So it's really important to keep contact with family and friends, even though you might be physically distant, to be socially connected. However, relational contagion can also work the other way and can increase dysregulation if one connects with or is exposed to dysregulated individuals. And this may very well be happening in the workplace where people are feeling very stressed. And this again is where leaders can play such an important role, because if you're a self-regulated leader, you can actually help your whole team to calm down. Whereas if you are hyper-aroused and anxious, then that can escalate anxiety in your staff. So just remember to breathe. Thank you.
Thank you so much, Rita. I really do appreciate it. A reminder to everyone again, we will be sharing the slides. So thank you for that. Rita, if you want to introduce the next speaker, I'm going to unmute Judith so long.
Okay, so Judith Anser is a well-known psychologist in Johannesburg in private practice. She has a wide experience with both working with adults and children, and she's a wonderful teacher. And she supervised and mentored many colleagues, so I'm really looking forward to hearing what Judith has to say. Thanks, Judith.
Thank you. I'm going to share my screen, which is always a challenge to get all of these tech things happening, but there I am, and I'm going to start the slideshow, which of course current slide. So yeah, I'm going to be talking about strategies that leaders and healthcare workers, and in fact any of you listening to this webinar, can use in terms of optimizing your coping skills during the pandemic. And this is really about getting real and about knowing what can help. And I think we've covered some of what I'm going to talk about, but I'm going to reiterate the value of using some very intentional and conscious strategies for managing both teams and your own personal well-being. So one of my favorite quotes that I've been using a lot at the moment is from the novel The Fellowship of the Ring, part of J.R.R. Tolkien's books, and of course the movie The Lord of the Rings. And Frodo says, I wish it need not have happened in my time. So do I, said Gandalf, and so do all who live to see such times. But that is not for them to decide. All we have to decide is what to do with the time that is given us. And I think that that's the baseline. None of us chose to live during a pandemic. We didn't have that choice, we don't have it. All we can do is the best we can to get through this as well as we can. And I think part of that is helping the people around us, the people who work with us, the people who work for us, and the people that we engage with, and whether it's in our professional or personal lives, to help them get through this in the best way that they can. So what does research tell us happens to working teams, especially in the healthcare system, particularly in the healthcare system during pandemics? So international research says that what happens during this crisis is there's a flattening of the hierarchies, the traditional sort of management at the top, hierarchical structures of teams get flattened because there is the all hands on deck needed approach. And what we get is role diffusion. I remember early on in the pandemic sharing with some of my friends a meme that said, you know, wear your mask or you may be having a psychiatrist intubate you. And all the psychiatrists laugh because they haven't had to intubate anybody in years. And we know that there was the sense, especially as the numbers increase, that everybody's needed in managing the health of the population. But with this sort of role diffusion and this all hands on deck, you do get a lot of burnout, a lot of people taking leave, whether it's because they're in quarantine, whether they're self-isolating because they've tested positive, shifts change, people's leave gets cancelled. There's a lot of stress around that. And what we see are high levels of stress and burnout, as Antoinette mentioned, and Tanya. What we also see, as Tanya mentioned among the nurses, but in all teams, is you get flare-ups of old conflicts between people and the emergence of new irritabilities and a sense of unfairness. But what is essential and what will get us all through this is a collaborative approach. And this is where leadership is important. Someone already asked in the chat, how do we make our managers understand this? Well, apart from asking them to watch the recorded version of this webinar, I think you need to approach management, if you're not one of the people in management, and talk to them about how your teams are coping and the importance of a leadership role that ensures a sense of teamwork. Tanya put it beautifully when she said, it's not about where you work, it's about who you work with. And building on that collaborative approach will help teams be resilient and be strong. So what can the leader do? Some of the principles we've identified for effective leadership of healthcare teams during crises are that the leaders of the teams need to operate as containers for the anxiety of their staff and their team. Now, of course, it's difficult when you as a leader are anxious yourself, but that is the project, to enable leaders to model appropriate self-care. So leaders also, managers, need to take time off. They need to model an appropriate compassion for other people and themselves. And the literature from both the UK, the NHS, and from China spoke about the importance of leaders being the calm center of the storm. It's not easy. This is the kind of thing we strive imperfectly to achieve, but to become the compassionate, capable, calm leader that a team needs will really go a long way. One of the things that I found really interesting is a principle that comes actually out of military psychology, which for doctors and psychiatrists working in the military with people at risk for PTSD found that this process of PIES, treating immediately close to the front lines, quickly and simply, with an expectation that the person will return to duty as quickly as possible, was found to be the most effective in managing trauma and crisis responses in times of great crisis. So we talk about this as proximity, immediacy, expectancy, and simplicity. So the idea is not to do things like trauma debriefings, which is absolutely contraindicated as a first line of approach for managing distress. And we'll cover this in greater detail in webinars 2 and 3. So trauma debriefing is not the approach that the Healthcare Workers Network uses, but rather a psychological first aid approach that allows both the healthcare worker and the leader to get the support to go back to work, especially during this peak of the pandemic. So what's really important are connection and communication. Someone asked on the chat about how do people communicate when meetings aren't allowed, face-to-face big meetings. Obviously, there are still shift meetings with social distancing, with masks, maybe even in PPE. So those are important. Regular start of shift or end of shift, brief touching meetings are very important. But so too are things like WhatsApp, which can of course be used for many, many funny videos of kittens, but are also important ways that teams can communicate about issues that are happening in the team, but certainly ways of sharing support and sharing information. It's very important that leaders and managers and organizers of teams share what is happening. Tanya spoke about how fluid the situation is, how often information changes, how much situations change. And that's why the sharing of information as it happens is important, but this must be done by leaders in a simple, clear, and concise way. It's really hard because healthcare workers are people too, and we all see the fake news. We all see the alarming, worrying histrionics of the fake news, the social media hysteria. It's important that our healthcare workers, particularly like the rest of our society, get accurate information. But it's also important that we manage the information overload. I mean, there are just so many webinars that we can go to. There are so many articles about COVID we can read. So one of the things we always suggest is to encourage people to take social media breaks, to not read your social media just before you go to sleep, because that of course is incredibly stressful, and to manage that information and emotion overload that comes from being in touch with the debates, with the information all the time. Another very important, useful thing is end of shift debriefing. At the end of a shift, that you can touch on what went well and what can we do better next time. The idea of the end of shift debriefs, whether it's in person or via WhatsApp, is not to berate people or criticize, but to focus on finding solutions, the thinking together to find solutions together. What is really, really important is to help as managers to understand the things that Antoinette was mentioning, that all our staff have people at home too. They struggle with PPE, and the research internationally showed that the anxiety about PPE and having access to adequate protection was a huge source of stress for staff. It's useful as a manager or leader to be aware of your staff's issues around how they get to work. What are their childcare issues? Have they taken leave? Are they managing their shifts? And also to talk with people about the quarantines and self-isolations that may be necessary when people are exposed to COVID. I know there's a lot of controversy and difficulty, but it's the kind of thing that if you've got concerns, raise it in advance. Physically in the workplace, it's always ideal if physical time out spaces can be made where staff can go, especially if they can take off their PPE, to go and have something to drink, to eat something, and just to do the breathing activities that we really recommend that people do just to regulate themselves. And I will go through one of them very briefly before the end of my presentation. And one of the support systems that's been found to be incredibly helpful is the buddy system. And of course, we always know that SOCs need to stay with their buddies, and so do we as healthcare workers need to be mindful of our colleagues and check in. And if you can, as a leader or manager, within a team, appoint people to be buddied up, to put maybe a more experienced nurse with a less experienced nurse, and just ask them to check in with each other, whether it's once a day or whatever what is possible, just to allow that as an additional source of support can go a long way in helping a team feel like a place where people are noticed and seen and cared for. I think that as leaders, and as colleagues, it's really important to share the stress reduction techniques. Rita went through them in great detail, but there is nothing more simple, and after going to Dr. Manga's course on Saturday, I'm convinced nothing more powerful in the short term than just learning how to breathe effectively. And the strategy that Dr. Manga suggested is, just as a start, to practice breathing in through your nostrils if possible for a count of 5, and then breathing out for a count of 5. And she also suggested that as you are breathing in for the count of 5, you just lift up your hands for the count of 5 and then breathe out for the count of 5. She called this coherent breathing, and it's absolutely simple. And she said and made the point that if you practice breathing carefully, you regulate all those physiological stress signals. You regulate your thinking, you allow your upstairs brain that Rita showed us, the top part of your thinking brain, to come into its own, to start managing the anxiety. So she recommended 5 minutes 3 times a day, but even whenever you've got a moment, whether it's as you're falling asleep, whether it's first thing in the morning, whether it's while you're waiting for the kettle to boil, to just practice breathing in and breathing out. That's simply all you have to do. There are many, many grounding and mindfulness techniques that allow people to engage the thinking part of their brain and to regulate that physiological distress. And all those strategies allow people to own and hold onto those feelings without being afraid of them. There's a principle often used in parenting work by the Dr. Daniel Siegel, who speaks about the power of naming feelings in order to tame them. And I think that if you can name your feeling, if you can bring yourself to think about your feeling, you can claim it, own that you have it, whether it's a difficult feeling, whether it's a feeling that you've never known that you're allowed to have. We know that this is a time that people are having very difficult feelings of anxiety, stress, frustration, anger, unfairness, fear, really bewilderment. All of those are legitimate, normal feelings to have in this very difficult, abnormal time. If you can own the feeling, you can tame it. If you can claim it, you can tame it, you can get unstuck. The next slide, which I hope you all look at when we share the slides with you, is really a strategy. It's also on the Healthcare Workers Network website. It's a number of activities that you can just do for yourself or suggest to your team to do. There are activities that take 30 seconds, like a breathing activity, or just sipping a glass of cold water, or just suddenly bringing yourself to be aware of where you are, thinking about a happy memory. There are activities you can do if you've got 3 minutes. That might be making a warm cup of tea or sending a text to a friend, just reaching out. There are longer activities that you might need to be at home to do, like having a bubble bath or putting on music that you really enjoy and singing as loudly as you can. Tanya spoke about the value of singing, and I think that's really important. And the other things you can do that are really important as a leader is to acknowledge and normalize those feelings and to be real with your staff. To be real that this isn't something that's going to be over quickly. The cliche we all find ourselves going to is that this isn't a sprint and it's a marathon. It absolutely is a marathon, and it's not simply going to be a marathon. It's going to be a relay race where we need to get support from other people. We're going to have to allow our colleagues to share the burden of this race with us. And it's okay to be real with your staff as a manager about what you can and can't do, especially in the context of big organizational politics, institutional difficulties, the healthcare system as it is. It's okay to acknowledge that we can't fix everything. And check in as a manager with your staff and colleagues regularly. If somebody is taking more leave, if they're coming to work late, if they've changed in their behavior, just check in with them, because we know that the stress is, we are seeing either a resurgence of pre-existing mental health conditions or the emergence of new mental health conditions. So what's really important is to help our staff and ourselves remember the why of the work, the why of our jobs, why we are doing this, and to honor our work. I like what someone said in the chat a bit earlier about gratitude, about acknowledging the work of healthcare workers in every respect, not simply the doctors and nurses in hospitals. It's the porters, the people doing the laundry. It's the people who are driving the ambulances. It's the social workers. It's people working not just in hospitals, but in all kinds of care institutions, whether it's old age homes or children's places of safety. All of those people need to be acknowledged and need to keep reminding themselves of the why of the work and to honor that. We also need to be real about the limits of our powers and tolerate all our imperfections. We need to be kind both to ourselves, to our staff, and to our colleagues, and really resist the temptation to judge, because actually most of us are doing the best we can. And we're going to need to be brave in the face of what is a really challenging period of time. I want to end with one of my favorite ideas of the last few months, and this comes from Japanese art. In Japanese ceramics, there's an idea that when a ceramic bowl gets broken, you don't throw it away, you can mend it. And there's an art form that is mending broken pottery with gold. And when you mend the pottery with gold, it's imperfect, it's flawed, but the recovery makes the art more beautiful. And this type of work is called kintsugi, or the art of precious scars. And this links to a very important idea in psychology, and that is that when there's been trauma, there is the possibility of post-traumatic growth, not simply post-traumatic stress. It's not a promised outcome. Post-traumatic growth is something we strive for and we are aiming for. And what we hope both as a country, as a community, and as individuals is that we can get through this period of time learning something about our strength, learning something about the power of collaboration and care and compassion and community. And while we do that, I want to end with a quote by Leonard Cohen, who reminds us to ring the bells that still can ring, to forget our perfect offerings. There is a crack in everything. That's how the light gets in. There's nothing perfect about what we're doing. We're making mistakes. We're learning as we're going along. The systems are failing us at times. Our colleagues can't always get it right, and we can't always get it right. But while we can still ring the bells and find the joy and the music and the pleasure, that's something we should aim for. So I'm going to end it there and stop sharing my screen at this point. And yeah, hand over for any questions or comments. Thanks.
Thank you so much, Judith. I really appreciate everyone, you know, as you're talking, you're having those aha moments. And I think this is why it's so great that we go in equipped with all these different skills. And I'm really glad that this is series 1, you know, or webinar 1 of a series of 3. So we've got some time now for just some Q&A that we're going to share. And we're just going to open up. I know some of you have sent me questions that I'm going to ask the panel. And I'm going to start off with Antoinette. I've got a question here from you, from Pierre. It goes, it strikes me that what is different about COVID versus SARS is that COVID, the trauma is also being experienced by the community because COVID is more generalized epidemic. So the trauma is experienced by healthcare workers and ordinary citizens. So the trauma is in a sense compounded. There is no escape. Can you give us comments?
So yes, I mean that's a very, very accurate comment, and you know we can use SARS as an example, but the example we're using quite a bit is HIV. So the HIV epidemic, well, when I remember when I was quite a young doctor in 2002, I was doing my internship. There were no ARVs, so there was quite a lot of distress and managing these patients and children who were just dying, really. But the trauma was different because it wasn't within my family, it wasn't within my friends, it was in the community, but it wasn't all over the community. And it is very different. And I think that is, even for those of us who are mental health providers, there's the vicarious trauma, which we've started to talk about, which is the trauma through listening to our patients, because it's everywhere. It's in our community, and then you may have an auntie who's sick, and then you're hearing a patient, and then you're hearing about a colleague. So it is all over, and I think that is what makes this situation incredibly stressful. And everyone, I mean, I think is feeling some mental health effect. I think they would be abnormal if they weren't. But yeah, it is an important thing. And, you know, when we look at the research, there is actually no research to predict what is going to happen. And yeah.
I think there's a really nice saying that talks about, you know, we're all in the same storm. We're just in different boats. And that's so true, is that healthcare workers and ordinary citizens, we're all dealing with the impact of COVID. The next question I'd like to pose to Prof. Rita, how as clinicians do we get our line managers to stop burying their heads in the sand and recognize that their staff are or may be struggling? There is still so much stigma, and this is not even addressed in the workplace at all. How do we tackle this?
Yeah, so I mean, I think in a way this is an opportunity. I mean, it's a crisis, but with crisis come opportunities. And as Judith mentioned, you know, in a crisis like this, in pandemics, the hierarchies get flattened. And the whole issue of mental health, I think, is very much becoming in the forefront. So people are talking about the second pandemic being a mental health pandemic. So I think people are more aware, and I think that does allow healthcare workers to approach their managers and their leaders, you know, to start engaging, start those conversations, and to emphasize how important it is to do the preventive work, which is what a lot of what the healthcare worker care network's trying to do, is to prevent the distress and prevent the burnout. Yeah, and just, you know, as someone, I think Judith said, you know, to encourage the leaders to listen to these kinds of webinars as well.
Thank you for that. And I think, you know, I think it's why it's so important that we equip and take this time to learn as much as possible. And here I'd like to also come over to Judith and ask a question that has popped up with regards to how do we get our managers and our team more empathetic? What should they be doing to look after our team? And I know you gave a couple of tips and tools Is there anything else that you would like to add? Perhaps how do we make our managers more empathetic during this time?
Well, I think it's just to reiterate what's been said is that, you know, it's difficult. If your managers are not coming to these webinars, you could go tomorrow or on a WhatsApp and say, I went to this webinar. It was really brilliant and it was really interesting. And they spoke a lot about what makes teams successful during a pandemic. And I got these ideas, like they said we should have a WhatsApp group for this shift or a WhatsApp group for this team. And they suggested that we make a buddy system that maybe you as a healthcare worker can try and initiate something. And it's always difficult to do it from the bottom up. But what we hope is to say, you know, to rather than go and say, you know, you mustn't, I saw one of the people said some of the matrons might use threats rather than acknowledgements. And it is a relic of old-fashioned hierarchies in all kinds of hospital and work, all kinds of organizational systems. So to go in and say, I've got this idea that I got from this webinar, here's the link, why don't you watch it on the YouTube channel? And it would really help us. And also to acknowledge that the managers are often also incredibly stressed because they're getting stress from their managers, whether it's Department of Health or it's the board or it's whoever, the shareholders or their execs, everyone's under stress. So it's a tricky situation, but I hope that this kind of message can get out eventually. You know, we're doing our best to propagate it. We send out, through our healthcare network, we send out emails every week, every second week to all the managers we know about. If you have a manager you think would benefit from getting our message in a more direct way, privately send us their email address. You know, just put it in the chat now or send it privately to Cassie and she'll pass it on to us and we'll add them to our mailing list. We send them a very brief email because we know everybody gets too many emails. Nobody can read all the information, but maybe they'll get like the idea that there are strategies that they don't have to be afraid of. But let's work kind of one imperfect drip at a time till we get a whole puddle.
Absolutely, I love that. One imperfect drip at a time. I'd like to come over to Prof. Tanya. There's been a couple of questions with regards to nurses. And I think, you know, again, sharing those messages of hope, almost kind of best practice. What have you been seeing of some strategies that have already been working or some hospital taking on strategies that are looking at nurses or even just making sure that their mental health is taken care of or even just showing signs of appreciation during this time?
I think the WhatsApp groups have worked well. They have got WhatsApp groups. I think some have sort of not incentives, but appreciating hard work that somebody has done, saying, listen, I saw you did this, well done, or I see you have tried this initiative, well done. But to be quite honest, there's not much of that. I'm seeing the opposite. I'm seeing one small thing goes wrong and everybody's on it. And this is really sad to me. If you speak to managers, they tend to say, oh, the nurses, they can't do it. And I wish we could turn that around because that's what we should do. If we don't support the people on the ground, we're going to lose them. And yeah, it's sad, but there's not much of that. There's not much appreciation.
Yeah, we often see that overseas they have all kinds of different mechanisms and you know, clapping and songs, and we don't see enough of that in South Africa yet. And perhaps, you know, working as a collective, we can show various ways of support and appreciation. Antoinette, I just wanted to come to you and chat a little bit about, you know, vicarious trauma, especially as healthcare workers. How do we tackle that, and how do we really deal with what we're dealing with on a daily basis and the impact that it has on us? Yes. I can't unmute. Sorry. Okay, should pop up now.
Sorry, you're playing mute, unmute. Yeah, how to deal with vicarious trauma. I think Judith might be a little bit more qualified at answering this. I mean, I think it's about understanding what it is. I think it's always present, specifically in mental health professions. But actually at this stage, it's all healthcare workers are going to be experiencing it. They're going to be experiencing their patients maybe being really unwell without their family and the trauma of that. And specifically for kind of mental health providers, I think, I mean, I go to supervision, and a lot of people go to supervision. It's really, really important. Peer support, making sure you're looking after your own mental health. But I think the big thing is probably peer support in terms of that. It's talking about it, being aware of what it is. So it's being aware and taking action. So we actually are running volunteer support groups. I'll send out another email to everyone who's on my mailing list. And it is a place where, you know, we can talk about these issues. Can't hear you, Cassie, sorry.
Sorry. And perhaps, Judith, we can just bring you in as well if there's anything else that you would like to add. You know, how do, you know, healthcare workers deal with that vicarious trauma?
Well, I think Antoinette said it, it's peer support is something that psychologists and social workers have long made incredibly good use of. And I really encourage that for other health professionals, peer support. And I think that's kind of supervision and finding that balance, you know, in our lives, finding that I think one of the hard things that I've seen, even for people in private practice as well, has been that there isn't the same, people haven't taken leave in the same way because it feels like there's nowhere to go. I'm so jealous. All of those of you who are at the coast, I really hate you all, frankly, that you can.
Yeah.
I can go to Delta Park with 20,000 other Joburg people with our masks because we can't leave the province. But I think that kind of thing, like self-care, it's like such a cliche. It feels so simplistic and so obvious. And I wish it was really like fancy things that I could charge you a lot of money and I'd get rich telling you what to do. But basically, if you breathe, drink lots of just water, Joburg water is okay. Like go for walks in the park. You don't have to spend a lot of money. And those are the bases for kind of trying to survive this. But also if you're struggling as a healthcare worker, because the doctors I work with always tell me, doctors never ask for help. But that's true, I think, of most healthcare workers, is get help. If you're struggling, don't call the network. There's a free line, but get support for yourself. There's nothing to be ashamed of. It's a very difficult time.
Absolutely. And you know, I think this is where we share as many resources as possible, and, you know, equipping people so when they do need help, they know where to go. And I think one of the questions that had popped up was there needs to be a helpline or some kind of support. And I'm actually wanting to come and interject there because you read our mind. So if I can just also then share the Healthcare Workers Care Network, and please, I urge you to all go to the website. It's healthcareworkerscarenetwork.org.za. All of these resources, videos, articles, guidelines, is all around the mental health of healthcare workers that you can use and share. But some of the support mechanisms that are in place through the network is a 24-hour dedicated toll-free helpline for all healthcare workers. So whether you're a hospital porter, whether you work in the kitchen, you're a community healthcare worker, or you work in an old age home, or you're a doctor or a nurse or even a student, there is access to free 24 hours a day telephone counseling. During the day, it's manned by volunteer psychologists from around the country, including social workers and registered counselors. And then from there, you get free telephone counseling. And then if needed, you also get referred to pro bono individual sessions with a mental health professional. At the moment, we have over 600 volunteers around the country who are psychiatrists, psychologists, social workers, registered counselors, and even GPs with a mental health interest. And they're able to provide full pro bono sessions to help you cope. The great thing, again, from the website, you can go on and actually fill in an online request form for one of those individual pro bono sessions. And you can actually get referred within your region, within your province, to get access to help. The most important thing is we're wanting to equip people with all of these resources and providing support. What we can also do is share all of these posters, and all of the details are online. please share it in your WhatsApp groups with your colleagues, with your management, whoever you think. There's always someone that we know that could potentially need the help. And we're hoping that you never know when someone needs to refer back to their phone. And if we're sharing this as much as possible, when someone does need help, they can pick up the phone and reach out to the helpline. So thanks for bringing up that question. I know we've got 5 more minutes and a ton of questions, which is always so great when everyone gives input. Please know that your questions will not go unanswered. We will also address them at next week's session, which is next week, Tuesday. You don't have to re-register for the webinar. You can use the same link. We will send another confirmation email. You are also able to get 1 CPD point for every webinar session that you attend. So that's really useful. And again, the link was shared in the chat box that you can actually fill in the online form to get your certificate. Even if you need the certificate as an attendance certificate to perhaps show your line manager or your colleagues at work. Again, the website we will make sure is available. Perhaps in our last few minutes, I can go back to the panel and ask for your closing comments before we end the session. Judith, I'm going to start with you.
Just, it's so wonderful to see all the comments and the thanks. And really, I wanted to also thank you, Cassie, and the team, Antoinette, who's like really been a force to just get this going. It's amazing to think that we had a phone call all those months ago, I think in March, just as lockdown was starting, and what has grown out of it. And it shows the power of ordinary people to just get things done. And it's been amazing, and I think it's very inspiring. And it's been amazing to see the volunteer and the spirit of volunteerism. I think that's a word. And it's really just a good note to end on. So I'm happy.
Thank you so much, Judith. And I think it brings again that the ethos around the Healthcare Workers Care Network is that it's caring for the carer by the carer. Antoinette, I'm going to come to you for your final comments.
Thanks, Cassie. I think, yeah, I mean, I think it's important to know that this is the first of 3 training webinars. Each webinar is going to have different content and different speakers. So we've got fantastic speakers lined up, and we'll be meeting again next Tuesday and the following Tuesday. Everything will be recorded. CPD points will be given for the live sessions. You know, we can't guarantee, you know, in terms of the recorded sessions. If anyone wants to use any of these recordings in their workplace, you know, please feel free to. Please feel free to kind of put it up on a screen and show your colleagues. And I think what the messages which I started with is that healthcare workers are experiencing lots of anxiety and distress, and you know, lots of you know, concerns at this stage. But I think we need to keep in mind that it is in keeping with the general public and the general public's distress. We must be very careful not to over pathologize it and not and because when we over pathologize it, it makes it seem like that only mental health care professionals can fix it, and that's not true at all. The main thrust of the support will be from the community, will be from the managers, will be peer support. Obviously, we want to pick up those people who fall through the cracks. That is why we set up the network. We've got 2 arms. We've got the arm which we're doing now, which is the preventative arm, and then we've got the reactive arm. So if people need help, they can reach out. However, we are talking to the majority and what can people do. So I think those are the important concepts to keep in mind. Thanks, Cassie.
Thanks so much, Antoinette. I really appreciate it. Prof. Rita, Tom, over to you for your last comments.
Yeah, really just to echo what the others are saying, but, you know, I mean, we often spend so much time focusing on the negative. And as I said, this is an opportunity for transformation. You know, maybe not, that's a bit ambitious, but it is possible that small things, starting small, can grow into bigger things, that there's this kind of organic growth in a different kind of perspective. And I think it's really important for us to hold on to that while we grapple with the difficulties. So I feel very encouraged by this kind of meeting. Thanks.
Thank you. And again, we were so thrilled to have so many people who on a Tuesday evening join and want to learn more about this. And to end off, Prof. Tanya, if I can come through to you and to your passion, just to end off.
Well, I just want to say this is an excellent platform. It gives nurses an opportunity to, well, first of all, they can share what really works in their practices. I think we can set up something like that, because I don't think we really know what they do to actually cope in this situation. And then secondly, they have opportunities to get assistance if they want, to get help, to use the strategies that have been stated tonight. And the other thing is, I want to encourage you to invite all your managers. Let them come. Let them see what's going on. Let them see what people are thinking, saying, and maybe that can move us to a great COVID pandemic, if we can.
Yeah, no pressure. Here we go. But thank you for that. And again, yes, urge them on your WhatsApp groups, urge them tomorrow morning in your touch base session, urge them to attend. And again, just by you being here shows your dedication. So again, thank you everyone for joining. We will be sharing the recording afterwards. Really appreciate your time. Stay well and stay safe. And we will see you same time next week for session 2. Thank you. Bye-bye, everyone.
Bye.